Welcome back to Ask Premier Ed. We're going to be doing healthcare questions now, and here is the first question. Wayne in Edmonton asks, with a major deficit, would you consider reinstating healthcare premiums? Wayne, no, we will not reconsider reinstating healthcare premiums. For years, we were, especially by Albertans, said that these are a separate tax on Albertans. And when I had an opportunity to meet with many Albertans, I found out that many Albertans, be it small contractors, perhaps someone putting drywall up in a house, someone driving a gravel truck, or a single mom with a couple of children that's working very hard, earning a living, trying to feed her family, paying another $1,000 a year over and above what she had paid into her personal income tax. We will find other ways of ensuring that healthcare is funded appropriately in the province of Alberta, but we will not be reinstating the healthcare premium. We consulted considerably on this matter, and I said there won't be no new tax increases, and to me this is a separate tax, unfair to many Albertans. Now, there are a lot of people that are asking for a reinstatement, but unfortunately, in many cases, it's either someone that had their healthcare premiums paid for by the employer, or perhaps people that were below a certain income line that did not pay, or anyone that was senior in this province didn't pay any healthcare premiums either. There was that narrow band in the province that paid. So that's why we won't be reinstating them. Thank you. Melanie in Calgary, why do you want to shut down hospitals when we already have so many sick people out in the streets? Well, Melanie, we're not shutting down any hospitals. We will be looking at transitioning some of the seniors that we have presently in acute care beds in Edmonton and Calgary. We're told about 300 in each larger jurisdiction that are awaiting placement, appropriate housing. They're tying up acute care beds, so people now are waiting longer in emergency rooms and waiting longer for acute care beds. By moving seniors to appropriate housing, we will free up many additional beds in the province. Health Ministry and Alberta Health Services will continue to receive additional funding. It will not be the 10 to 12% funding that they were receiving in years past, because it is not sustainable. However, we will ensure that when we transition our seniors to appropriate housing, we will do it in such a way that they can retire in the very same community that they helped build, retire and live in a facility as a couple, and not to be separated like we do today and put one in a lodge and the other one perhaps in a nursing home. That is really unfair to our seniors. So the health department will continue to see increase in the budget, and we will very quickly move to building new facilities for our seniors in the province of Alberta. Gina in Rocky Mountain House. Why are you so determined to privatize everything? I want full universal health and pharmacare for all of my old age and the future of my grandchild. Don't you care about people who can't afford to pay for services and who don't have a company insurance plan? Well, Jean, I can tell you that my government is fully supportive of a publicly funded healthcare system, not only in Alberta, but in Canada. And we also want to make sure that it's sustainable for the next generation. So that means we have to make some important decisions as to how healthcare will be funded in the future, how we're going to ensure that the very well-trained nurses and doctors provide the appropriate care for Albertans, and how do we ensure that we improve the quality of care in Alberta. We've been fortunate because of the wealth created in the province. We have a lot of new facilities, the latest technology, whether it be in cardiac, cancer treatment, diabetes, but we have to ensure that the next generation enjoys the same health care. And I can tell you that once again, there is no plan to privatize any of the health services that we have, and in fact we're working very hard to ensure that the health services remain in a publicly funded mode, because it's a very good system, not only for Alberta, but for the country of Canada. And we have to keep in mind, obviously, we're going to have some pressures over the next few years, because our population will be aging. We have, of course, more people moving to the province, and we'll have to make the appropriate decisions in this area of funding so that we can sustain the system.